Warning: these shower habits cause heart attacks and strokes. 80% preventable. It might be difficult to believe, but the simple act of showering, something many of us do every single day without a second thought, could be silently increasing your risk of a heart attack or stroke. The bathroom, a place most people consider safe and even relaxing, is in reality a hidden danger zone for many. Each year, a significant number of adults over the age of 60 experience serious cardiovascular or brain events while showering or shortly thereafter. What makes this situation even more concerning is that the vast majority of these alarming incidents are entirely preventable. The tragedy here isn't a matter of bad luck, it stems from ingrained, often unrecognized habits. Cardiovascular research has revealed that a confluence of sudden physiological changes within the bathroom environment, shifts in temperature, blood pressure, and blood circulation, creates a perfect storm, particularly for an aging heart and brain. The most chilling aspect of this phenomenon is that many individuals who suffer these events felt perfectly fine just moments before. There were no preceding warning pains or dramatic symptoms, just a routine shower that abruptly transformed into a medical emergency. As Dr. Charles Bennett explains, it is crucial to understand the most perilous shower habits that can silently jeopardize your life, especially if you are over 60. More importantly, he aims to empower you with the knowledge of how to shower safely, thereby safeguarding your heart, your brain, and your continued independence for years to come. If avoiding a heart attack or stroke is a priority for you, then paying close attention is paramount, as the information that follows is genuinely a matter of life and death. A fundamental aspect that very few medical professionals take the time to thoroughly explain is how, after the age of 60, your cardiovascular system becomes considerably more susceptible to sudden stressors. Your heart's ability to accelerate its rhythm smoothly diminishes, and your blood vessels begin to lose their elasticity. Consequently, your blood pressure can react more rapidly and unpredictably to changes. The bathroom, and specifically the shower, is one of the few environments where multiple extreme physiological shifts occur almost simultaneously. Exposure to heat, the presence of steam, the act of standing upright for an extended period, and the redistribution of blood within your body. While a younger body can generally manage these combined effects without issue, for an aging heart, the consequences can be catastrophic. A long-term study, published in a leading cardiology journal and involving thousands of older adults, discovered that those who engaged in certain showering habits were more than 3 times as likely to suffer a severe cardiovascular event. Disturbingly, almost none of these individuals had ever been warned about this significant risk beforehand. Let's begin by examining the most dangerous habit of all: showering with excessively hot water. When we refer to very hot, we mean water temperatures exceeding 40 degrees Celsius, the kind that feels deeply soothing and produces abundant steam, often perceived as therapeutic. In reality, this can be life-threatening. The moment you step into very hot water, your blood vessels undergo rapid dilation. It's as if every small capillary in your body suddenly widens. This widespread vasodilation leads to a sharp and sudden drop in blood pressure. Your brain, sensing this precipitous decline, sends an urgent signal to your heart, commanding it to pump harder and faster. Within a mere couple of minutes, your heart rate can escalate by 30 to 40 beats per minute. Such an abrupt increase in workload is exceedingly perilous for an older heart. A heart in your 60s, 70s, or 80s is simply not equipped to handle these sudden spikes in demand. It is akin to forcing an aged engine to instantly rev to its maximum speed. Something is highly likely to break. This intense stress can precipitate dangerous heart rhythm disturbances, diminish the oxygen supply to the heart muscle, or cause a sharp rise in intracranial pressure, thereby escalating the risk of stroke. Extensive research analyzing sudden deaths occurring in bathrooms revealed that the majority of these fatalities happened during showers involving very hot water. The combination of heat and steam also reduces the oxygen concentration in the bathroom air, compelling your heart to work even harder just to maintain adequate oxygenation of your body. I recall treating a 71-year-old gentleman who was fond of long, intensely hot showers, which he claimed aided his relaxation. One morning, after a particularly scorching shower, he experienced chest tightness, but unfortunately dismissed it. 2 hours later, he was admitted to the hospital suffering from a significant heart attack. His cardiologist was unequivocal. The hot shower had triggered the event. Had the water temperature been lower, it is highly probable that the heart attack would never have occurred. Current medical guidelines now strongly recommend that adults over 60 maintain their shower water temperature within the range of 35 to 38 degrees Celsius. At this temperature, your body can adapt more gradually, avoiding the shock to your cardiovascular system. A straightforward rule of thumb is this: if your skin turns an intense red, if the bathroom becomes heavily steamy, or if your breathing feels strained, the water is undoubtedly too hot. Rectifying this single habit can transform your daily shower from a potentially risky gamble into a safe and predictable routine, effectively eliminating one of the most significant hidden dangers from your day. However, the peril of hot water is not the sole concern. A second, potentially fatal habit is something many people mistakenly believe to be beneficial: sudden temperature changes, specifically alternating between hot and cold water, or even more controversially, ending a shower with a blast of cold water, purportedly to invigorate circulation. For older adults, this practice is akin to delivering an electrical shock to the heart. When the body, accustomed to warmth, is suddenly subjected to cold, the blood vessels constrict violently. This can cause blood pressure to spike dramatically within seconds. Simultaneously, the body releases a surge of adrenaline, leading to a sharp acceleration of the heart rate. This potent combination significantly amplifies the risk of dangerous arrhythmias and hemorrhagic strokes. Scientific studies have demonstrated that abrupt temperature fluctuations dramatically elevate the likelihood of irregular heart rhythms in adults over the age of 65. In nations where finishing showers with cold water is a common practice, a substantial proportion of sudden bathroom-related deaths occur precisely at the moment of this temperature transition. Some older individuals even attempt full cold showers after observing younger people engaging in this practice on social media. This is exceptionally dangerous. There are documented cases of sudden cardiac arrest occurring within the initial minute of cold water exposure in adults over 60. While a younger heart might possess the resilience to withstand such stress, an older heart often cannot. I remember a 68-year-old woman who decided to try finishing her shower with cold water, having heard it was healthy. The instant the cold water hit her back, she experienced crushing chest pressure and severe dizziness. She survived solely because medical assistance arrived promptly. Her physician's assessment was blunt: she had been seconds away from a heart attack. If any adjustment in water temperature is deemed necessary, it must be performed gradually. Reducing the temperature by only 1 to 2 degrees Celsius per minute allows the body sufficient time to adapt. However, for the vast majority of older adults, the safest and most straightforward rule is to maintain a consistent, warm temperature throughout the entire duration of the shower. It is not worth gambling with your life. By eliminating sudden temperature shifts, you remove one of the highest risk triggers present in the bathroom, ensuring your shower remains a calm, controlled, and safe experience. We now arrive at the third potentially lethal habit: spending an excessive amount of time under the water. Many older adults relish showers that extend for 15, 20, or even 30 minutes, viewing them as a time for relaxation and therapeutic benefit. However, each additional minute contributes to cumulative cardiovascular stress. Prolonged exposure to warm water can lead to gradual dehydration, as you lose essential fluids and electrolytes without necessarily realizing it. This can cause your blood to become thicker, increasing the risk of clot formation. A clot forming in the heart results in a heart attack, while a clot reaching the brain causes a stroke. Furthermore, standing for extended periods under warm water causes blood to pool in the legs due to vasodilation. This pooling reduces blood flow to the brain, explaining why so many individuals experience lightheadedness or faintness in the shower. Research has indicated that showers lasting longer than 10 minutes significantly elevate the risk of fainting and dangerous falls among older adults. But here lies the most critical detail. The most perilous moment is not during the shower itself, but immediately after stepping out. This is when temperature adjustments occur, blood pressure must recalibrate rapidly, and dehydrated blood struggles to circulate efficiently. The majority of shower-related cardiovascular events actually happen within the first few minutes after exiting the shower. I once treated a 74-year-old patient who enjoyed long morning showers. One day, as he stepped out, he became dizzy and collapsed, suffering a stroke. The prolonged shower had dehydrated him, thickened his blood, and the subsequent sudden drop in blood pressure allowed a clot to travel to his brain. For adults over 60, medical associations strongly recommend keeping showers to a maximum of 5 minutes, with an absolute upper limit of 7 minutes. This duration is sufficient for personal hygiene without accumulating dangerous levels of physiological stress. If you find yourself needing more time, utilizing a shower chair can significantly mitigate the associated risks. Reducing shower length does not necessarily mean sacrificing comfort. It dramatically enhances safety and sets the stage for the crucial information that follows, as timing, movement, and hydration are as vital as temperature and duration. Moving on to the fourth detrimental shower habit, this one often surprises people because it has nothing to do with water temperature. It concerns when you shower. Specifically, showering on a completely empty stomach or showering immediately after consuming a meal can place your heart under extreme stress. For many adults over 60, these timing issues are the hidden triggers behind sudden dizziness, fainting spells, falls, strokes, and cardiac emergencies. Let's delve into what transpires when you shower before eating. Upon waking, your blood sugar levels can be quite low, and your body is still in the process of transitioning from sleep. Your circulation may be slower, your hydration levels are often reduced, and your brain is not yet fully energized. If you then enter a shower, particularly a warm one, your blood vessels will dilate, causing a drop in blood pressure. Now, when you combine this with low blood sugar, your brain may not receive sufficient oxygen and energy simultaneously. This is precisely when the classic warning signs, which are often unfortunately ignored, begin to manifest. I feel a little lightheaded, I feel weak, or my vision went dark for a second. In the space of a moment, you could lose your balance on a wet floor. I have witnessed this scenario far too many times. One patient once confided, "Doctor, I always shower first thing in the morning because it helps wake me up." This sounds entirely harmless until it isn't. One morning, about 3 minutes into her shower, everything began to spin. She attempted to exit quickly, slipped, hit her head, and ended up in the emergency room. Her blood glucose was low, and her blood pressure had dropped significantly. The shower hadn't woken her up. It had drained the last vestiges of stability her body possessed. Now, let's consider the other critical timing mistake: showering immediately after eating. Following a meal, especially a substantial one, your body diverts a significant amount of blood to your digestive system to aid in digestion. Your heart is already working to support this process. If you then proceed to shower, the warm water once again causes blood vessels to widen and blood flow is shifted away from where it is most needed. Your heart is suddenly compelled to manage two competing demands: the need for blood in digestion and the shift in blood flow and pressure due to heat exposure. For an older heart, this overload can be the breaking point. This is why individuals often experience nausea, weakness, or dizziness after showering too soon after a meal. In more severe cases, it can trigger chest pain, arrhythmias, or fainting. Therefore, here is the safe rule that I impart to my patients. Never shower on a completely empty stomach, and never shower within the first hour after a heavy meal. The optimal timing in the morning is 30 to 60 minutes after a light breakfast. If you prefer to shower later in the day, ensure at least 2 hours have passed since your lunch or dinner. Implementing this single timing adjustment can dramatically reduce your risk. We now arrive at the fifth and final deadly shower habit, and this is the one that tragically leads to the most incidents because it occurs after the shower, when people wrongly assume the danger has passed. This habit involves standing up too quickly and failing to adequately hydrate both before and after the shower. Even after a safe shower, your cardiovascular system is still in a state of adjustment. Your blood pressure may be lower than normal, especially if you were exposed to warm water. If you then stand up rapidly, bend over, twist, rush, or step quickly, your brain can experience a brief loss of blood flow. This condition is known as orthostatic hypotension, a sudden drop in blood pressure upon changing position. In younger individuals, the body corrects this within a second or two. However, in older adults, the system responsible for regulating blood pressure is slower. This means you can remain in a danger zone for 10 to 15 seconds, which is ample time for a fainting episode and a potentially life-altering fall. What exacerbates this situation is dehydration. Many older adults do not consume enough water. The sensation of thirst tends to diminish with age, and some individuals restrict their fluid intake to avoid nighttime awakenings for bathroom visits. However, dehydration leads to thicker blood and weakened circulation. Add to this the fluid loss from a warm shower, and you step out with even less circulating blood volume, thereby increasing the risk of clot formation and making dizziness more probable. Therefore, here is the safest hydration protocol. Drink a full glass of water approximately 15 to 20 minutes before your shower. Then, drink another full glass after you are dressed and feeling stable. Throughout the day, aim for consistent hydration, unless your doctor has specifically advised otherwise due to a medical condition. Now, I will provide you with a complete, step-by-step safe shower protocol, the very same protocol that is taught in numerous senior safety programs. Understanding the dangers is important, but it is not enough. You need a simple, repeatable routine that offers protection every single time. The safe shower protocol, step by step. Before the shower, approximately 3 minutes of preparation. 1. Timing. Check. If it's morning, have a light snack first. If showering later in the day, ensure at least 2 hours have passed since your last full meal. 2. Hydrate. Drink 1 full glass of water, approximately 250 ml, about 15 to 20 minutes before you intend to shower. 3. Prepare your environment. Ensure a towel is within easy reach. Have your clothes laid out. Place a non-slip mat in the shower or bathroom. And if you have any balance issues, use a shower chair. If possible, keep the bathroom ventilated to reduce steam and strain. 4. Use the bathroom first. This prevents the need to rush mid-shower. During the shower, approximately 5 minutes total. 1. Temperature. Maintain a warm, not hot temperature, ideally between 35 degrees and 38 degrees Celsius. If you notice heavy steam or your skin turning bright red, the water is too hot. 2. Enter. Gradually. Wet your feet and legs first, then your arms, and finally your torso. Take 30 to 45 seconds to allow your body to adapt to the water temperature. 3. Keep it short. Aim for an ideal duration of 5 minutes with an absolute maximum of 7 minutes. If you need longer, particularly for washing your hair, do so while seated. 4. Listen to warning signs. If you experience dizziness, weakness, nausea, or shortness of breath, sit down immediately. Do not try to push through these sensations. 5. Finish smart. During the last 30 seconds, slightly lower the water temperature, not to cold, but just to a less warm setting. Then turn off the water and stand still within the shower for another 30 seconds before stepping out. After the shower, this is where most accidents occur. 1. Exit slowly. Maintain balance by placing one hand on the wall or a stable surface as you step out. 2. Sit down immediately. Utilize a chair, bench, or even the closed lid of the toilet. 3. Dry yourself. Seated. Begin by drying your feet and legs, then your body, and finally your head. There is no need to rush this process. 4. Dress. While seated, put on your underwear, shirt, and pants while remaining seated. 5. Stand up in 3 stages. First, gently move your legs up and down 10 times to stimulate circulation. Next, scoot to the edge of your seat and wait for 5 seconds. Finally, stand up slowly, holding onto a support, and wait for another 5 seconds before you begin walking. 6. Hydrate. Again. Once you are fully stable and dressed, drink another full glass of water. This protocol is simple, repeatable, and powerfully effective. Let me be unequivocally clear. You do not need to live in fear. What you need is awareness. Your shower does not have to be a source of danger. It can be a safe, relaxing, and even invigorating experience if you respect the physiological changes that occur within your body after the age of 60. To quickly recap, the 5 dangerous shower habits to avoid are: 1. Water too hot. Always keep the temperature warm, between 35 degrees and 38 degrees Celsius. 2. Sudden hot to cold changes. Never shock your body with abrupt temperature shifts. 3. Long showers. Keep them brief, ideally 5 minutes, with a maximum of 7 minutes. 4. Wrong timing. Avoid showering on an empty stomach or immediately after a meal. 5. Standing up too fast, plus dehydration. Always sit down after showering, rise slowly, and ensure adequate hydration before and after. If you implement these practices, you will dramatically reduce your risk. Important medical note. This video is intended for educational purposes and should not be considered a substitute for personalized medical advice. If you have pre-existing heart conditions, uncontrolled high blood pressure, diabetes, kidney disease, experience frequent dizziness or fainting episodes, or are taking blood pressure medications, it is crucial to discuss the safest shower routine for your specific situation with your doctor. Some individuals may require even shorter showers, perhaps only 3 to 4 minutes, or may need specific adjustments to the timing of their showers. And now, I want to hear from you. Which of these habits were you unknowingly practicing? Was it the overly hot water, the extended shower durations, showering before breakfast, or the habit of standing up too quickly? Please type "safe shower" in the comments section below as your personal commitment, not for me, but for yourself. Because one small, informed decision made today can prevent a future tragedy. If you found this information helpful, please subscribe to my channel. I regularly share simple, practical health guidance designed to help you remain strong, independent, and safe as you age. Furthermore, I urge you to share this video with someone you care about, whether it's a parent, a grandparent, a neighbor, or a friend. If they continue to shower using the old, potentially risky methods, they may be exposing themselves to a danger they are completely unaware of. I am Dr. Charles Bennett. Please take good care of your heart, protect your brain, and make your very next shower your safest one yet.